In this video tutorial, we are discussing types of the visual fields loss and their graphical representation. And in the next video, we will discuss visual field loss and their causes. So first of all, let us see the normal visual fields, how they are represented. Usually, the normal visual fields are represented as two white or empty circles with the black border. Respectively, the left circle on your left will represent the visual field for the left eye, and the circle on your right will represent the visual field for the right eye. And between this circle, we can conduct a midline which passes through the nose. So it looks like you are looking from the point of view of the patient. Also, we can subdivide each visual field for the two halves. Those visual fields which are closer to the midline or to the nose are known as nasal visual fields. And more lateral visual fields, they called temporal visual fields. Separately, if you subdivide each circle for the two halves, you may say that each circle has left and the right halves of visual fields. Next, we're talking about a total blindness, which is a complete loss of one or both visual fields, which can be represented as a complete black circle. In this case, you can see the right total blindness because the right circle is black, and left total blindness because the left circle is black. In some cases, you may get bilateral total blindness, respectively represented as both circles will be completely black. The circumferential blindness is a circular loss of the peripheral part of the visual field, which graphically is represented with a very thick border of the circle representing the visual field. Next, we're talking about the hemianopia. The hemianopia is a loss of the one half of the visual field. Hemianopia may be unilateral, which is subdivided for the nasal and for the temporal unilateral hemianopia, and the bilateral, which is classified as homonymous and non-homonymous or heteronomous hemianopia. At this picture, as an example, you can see the unilateral hemianopia. So on the right side of visual field, we have loss of the nasal part. That means we can call this hemianopia as a right nasal hemianopia. In next example, you can see the left eye is losing its temporal portion of the visual field. That's why we call it left temporal hemianopia. Homonymous hemianopia means the loss of the same right or left halves of the visual fields for each eye. For example, on this picture, you can see the left homonymous hemianopia because both left sides are lost. Also, this type of the hemianopia may be called left temporal because for the left eye, we lose the temporal visual field part, and right nasal because we're losing the right nasal part of the visual field. The bilateral non-homonymous hemianopia may be two types. The binasal hemianopia, when you lose both of visual fields close to the nose, or bitemporal hemianopia, when both temporal visual fields are lost. The quadrantopia is a loss of the 1/4 or a quadrant of the visual field and may be classified for the upper quadrantopia when we have the right homonymous quadrantopia or left homonymous quadrantopia with the loss of the upper quadrants. And the lower quadrantopia may be classified as a lower right homonymous quadrantopia and a lower left homonymous quadrantopia. In the next video, we're going to talk about the different types of visual fields loss and their causes.